You're all doing a great job with your patients. And I just wanted to have a quick review of suctioning. Okay. What's the rationale for suctioning a person's airway?
Suctioning can provide comfort to a patient by clearing the air passages and easing the work of breathing.
Oh, and of course improves oxygenation.
Great. Now you want to limit the amount of time that suction is applied because oxygen-rich air is also removed with the secretions. What can happen if you suction for too long?
Can't that result in hypoxia, which is an inadequate amount of oxygen?
Exactly. When suctioning a patient, use personal protective equipment and aseptic technique at all times to prevent disease transmission.
And what should we assess when suctioning through the nose?
Well, you want to assess the nasal passages for obstruction and gather a history from the patient to find out previous problems like deviated septum or polyps.
Okay.
Now, I can't stress this enough. Suction should be applied when you are withdrawing the catheter. Never apply suction when inserting the catheter.
Miss Lewis, the patient I have is pretty serious and I need your help.
Of course. What's the situation?
Well, she had a cerebral vascular accident several years ago, which left her with residual muscle weakness, particularly in the throat. Her present condition has contributed to further weakness and poor muscle tone. She has a weak, ineffective cough, and she's unable to expectorate her secretions.
Have the nurses been suctioning her pharynx to remove the secretions and keep her airway clear?
Yeah, I think she needs to be suctioned now.
Okay, not a problem. Let's check the order for suctioning and see if we need to pre-medicate the patient with pain medication, and then we'll double-check your equipment.
Okay.
Great, that's there.
Okay. I think I have everything. The rest is in the room.
Yeah, I think you do. Lead on.
Okay. Miss Marconi?
Oh, hi, Anna.
Hi.
How
How are you doing?
Okay, I guess.
Okay. I'm going to help you get those secretions out of your throat. Okay. It'll be a little unpleasant during the actual suctioning.
All right.
But once we're done, you're going to feel a lot better. Okay. This is my instructor, Miss Lewis, and she's working with me today.
Hello, Mrs. Marconi. We're going to help you breathe easier.
That's great.
Okay, let me just take a look at your ID band. And can you tell me your name?
Julia Marconi.
Okay, just give me a moment to set up, all right?
Okay, fine.
Okay. I think I'm good.
Okay, so let's get you into position. I'm a righty, so I'm going to be on this side.
Okay, then I'm going to go around to the other side, Anna.
Okay. Let me lower these rails. And let's get this across your chest. Okay. All right, can you turn on the suction unit?
Sure. Okay. Here you go. Okay. Now we're looking good over here. The suction is on at 100 to 120 millimeters mercury of pressure since she's an adult.
Okay, this is where I need some help.
Sure, Anna. Well, the suction's on, so open the saline and then open the sterile suction catheter package and put on the sterile gloves.
Okay.
Uh-huh.
Now I set up the sterile container by pouring the sterile saline into it.
Right. Your dominant hand will remain sterile during the procedure because it will handle the catheter. Your non-dominant hand can be considered clean rather than sterile, so you can use it to pour the saline. Now pick up the sterile catheter with your dominant hand. Use your non-dominant hand to connect it to the suction unit tubing. Don't touch the sterile catheter with your non-dominant hand.
Okay.
Right.
Now I dip the catheter into the sterile saline to moisten it.
Uh-huh. Occlude the Y port to check the suction. The saline solution should flow through the tubing.
Okay, looks good.
Now estimate the distance from the patient's earlobe to her nostril. And then place your thumb and forefinger of your sterile hand at the point on the catheter that equals the estimated distance. So that's the distance that the catheter will be inserted.
Got it. Now I'll insert the catheter without applying any suction. You're going to feel a little pressure. Just try to relax. Okay? You're doing great.
You know this. Just keep the Y port open during insertion. The catheter should slip along the floor of the nostril toward the trachea to suction the nasopharynx.
Okay, I've reached the predetermined distance.
Very good. Apply suction by occluding the Y port with your thumb on your non-dominant hand. Gently rotate the catheter as you withdraw it from the airway. Don't suction for more than 10 to 15 seconds at a time.
Now I insert the catheter in the sterile saline solution to flush it.
Very good. Repeat the suctioning procedure as needed to clear the secretions, allowing at least 20 to 30-second intervals between suctioning attempts.
Okay, Mrs. Marconi, can you cough for me? All right. Take some deep breaths. Good. Okay. Very good, Mrs. Marconi. I'll just wrap the catheter inside my gloved hand and remove my gloves by containing the catheter inside the gloves.
Great. Now dispose of them and any other used supplies in an appropriate container. And let's get out of our PPE.
Okay.
Hi.
A little better?
Oh, feeling a lot more comfortable.
Good. I'm going to take a listen to your chest, okay? All right. Let's take some deep breaths. Very good, Mrs. Marconi. Let's get you back down here. Okay. Last thing, as always, document the procedure.
Note the nature and amount of the secretions, your respiratory assessment before and after the procedure, and your patient's response to the procedure.
Okay. You doing all right now? Good. This here for you. All right. See you in a little bit.
Bye-bye.